Hi there. I'm working on our assignment about how would I communicate with a mother about this sick child. I would say, I understand that your child has a cough that has been getting worse, nasal congestion for the last 3 days, and a cough and fever up to 101 for the last 2 days. I'm concerned with these symptoms as well as his exposure to illness at daycare. An increased respiratory rate, increased work of breathing that you can see in his tummy and his chest muscles, and nasal flaring. He also has some noisy breathing and some extra sounds called crackles in his lungs when I listen. Do you have any additional concerns, and is this all correct? And after she's answered that, I would go on to, what do you suspect is the cause for this cough, rhinorrhea, and wheezing? I suspect a respiratory tract infection. We're going to point to a lower respiratory tract infection due to the crackles, wheezes, fever, tachypnea, and respiratory distress. Fever for pneumonia is usually 3 to 5 days, but this also fits crackles. So then I move down to bronchiolitis. It meets all the diagnostic criteria. Viral, such as RSV or influenza, would be another differential diagnosis, and then asthma. What would you recommend to manage his symptoms? I would recommend supportive care, keeping those nasal passages clean with the suctions and the suckers. Hydration, also some saline spray would be helpful. Hydration, Tylenol and ibuprofen alternating to manage his fever, elevate the head when sleeping, and perhaps a humidifier. Looked up corticosteroids, and that's not really recommended. Diagnostic workup, we would do pulse ox to see if the patient is hypoxic, and a chest x-ray looking for hyperinflation or atelectasis. However, the chest x-ray is not required in order to diagnose this patient. And this patient can be diagnosed based off of their symptoms. Thank you so much.